This technique here is designed to work around scars that have formed after surgeries, and in the hopes of basically creating blood flow to those new nerves that have formed within that scar and creating more mobility to those scars. As you can see, our subject here has a scar around the pelvic region, and we've placed one scar just underneath the left breast tissue, indicating a possible mastectomy. So I'm going to begin by showing you some of the techniques that will improve some of that blood flow to that area. And one of the things that you want to do is to kind of bias that scar a little bit and try to break it up a little bit by either doing a shearing technique, either with one hand moving medially, with the other moving laterally, and then you can reverse that effect by trying to reduce the adhesions and thereby improving circulation. That's one of the techniques that we can do. And you would do that all the way along the actual scar from left to right or right to left. You can also take your hands and try to apply a gentle pressure into the skin tissues and push them apart to try to create a bit of mobility. This is all in the hopes of creating more mobility and increased circulation. Same procedure would apply for this scar here, which is located right underneath the left breast. And here we can basically, I can apply a palmar contact around that scar tissue, anchoring on the tissue above, and just trying to do a little bit of spreading to try to increase and improve the circulation to that area. Either technique will work. And it's basically, the premise is to just load that tissue in the directions that it does not want to go into and wait for that release. Very similar to the lumbosacral decompression that the previous demonstration showed. We can get right onto that scar itself and then just do very, very fine stripping of that scar to try to improve the elasticity and mobility of that scar. That's how you would treat that.